BSI is my scene safe. Scene safe. Okay. E-names. My environment is a baseball dugout. Number of patients is 1. Additional resources, yes, I need them at this time. Mechanism of injury is a blunt chest pain and shortness of breath. Evacuation is clear, and no spinal precautions at this time, but I will consider them. Okay. So my general impression is we have a young male, hunched over in some distress, with symptoms of chest pain in the dugout. Okay. So I walk up to the patient. Patient's tracking me, so AVPU's already done. Hi, my name's Ryan. I'm an EMT. Can I ask you a bunch of silly questions? Okay, what's your name?
Cody.
Where are you?
Dugout.
What day of the week is it?
Thursday.
And what's bothering you the most?
My chest.
Chest pain and shortness of breath. Okay. So he's AVPU times 4. Okay. His chief complaint is left-sided chest pain and a little bit of shortness of breath. Okay. So I'm going to go into my ABCs. Airway is clear because the patient's talking to me. Okay. Breathing. I'm going to take some lung sounds. Okay. So you take just a deep breath for me. Another. Another. One more. Another. Another. One more. And one more. Okay. Lung sounds are shallow and diminished on the left side. Everywhere else is normal. I take his respiratory rate. So count 15 times it by 4. Okay, his respiratory rate is 24 breaths per minute. So at this time I'm going to administer him to high flow oxygen via non-rebreather mask, and then move on to bleeding. Circulation, is there any major bleeds? No major bleeds, okay. I'm going to take his pulse. Okay, I'm going to make sure they're equal. 15. His pulse is rapid, strong, and equal. Okay, his skin signs were warm, pink, and diaphoretic. So I'm going to now transport him, high priority, code 3, and we're off. So now I'm going to do my sample. So signs and symptoms is chest pain in the left chest and shortness of breath. Already know that. Are you allergic to anything?
No.
Excellent.
Penicillin.
Okay, medications, are you taking any?
No.
Okay, past history I should know about? None?
None.
Last oral intake?
2 hours ago, dinner.
Dinner, okay. And events leading up to chest pain, what happened?
Got hit in the chest with a baseball.
Alright, so that takes care of that. Now I'm going to do my head to toe assessment, okay. So starting with the head, I'm going to inspect the mouth, the nose, facial area for any swelling, tenderness, abrasions, bleeding. Okay, none of that. So I'm going to palpate the scalp and the ears, looking for any fluid coming out of the ears. Is there anything with the head? Okay, I'm going to do pearl now. So patient is, pupils are equally round and reactive to light. So that's good. I'm going to now move on to the neck area. Okay, so I'm going to look for any jugular vein distension. Okay, non-trachea movement, trachea is intact, and then I'm going to check the spine, cervical spine as well for any bruising, swelling. So is that good? Area good? Alright, now chest area, I'm going to palpate the chest, starting with the right side, and then moving on to the injured left side. Tenderness and bruising when I touch it. Okay, I'm going to look for equal rise and fall of the chest. I'm going to take a deep breath. Okay, equal rise and fall. That's good. And then I'm going to check for lung sounds as well. Again. Take a deep breath. One more. One more. And one more. Okay, so the shallow and diminished lung sounds on the left side, again, so that hasn't changed. And now I'm gonna move on to the abdomen. So by palpating the abdomen, I'm gonna palpate the abdomen. Okay, abdomen's intact. I'm going to check the pelvis, so palpate the pelvis. I think I'm gonna have to make it lay down for that. So for this, patient should be flat when I palpate the abdomen. Okay, so all 4 quadrants. Okay, it's good. No, it's soft. It's fine. Pelvis is intact. Okay, that's good. So no swelling, and then I'm gonna move on to the lower extremities. So palpating the legs. Okay, legs are fine. Any swelling, bruising, tenderness. Okay, same thing with this leg. Good. All right, I'm gonna check for this. Okay, that's good. And that's good. Alright. So now I'm gonna tell him to push down on my toes. Scoot over a little. So push on my feet like you're pushing down on pedals. Okay, now pull up, toes to your feet. Good. And then I'm gonna check for pulses on each leg. Okay, we both have pulses. Alright. Sit back down. I'm going to check for upper extremities, so I'm going to tell the patient to squeeze my hand. Okay, squeeze my hand. What fingers am I touching?
Pointer. Pinky. Thumb.
Alright, I'm going to check for cap refill, so we have cap refill, and then we're good there, and I already checked pulses, we have equal pulses. Alright, I'm going to now move on to the thoracic. So turn around for me. Just make sure on this. Right over chair. Alright, so I'm gonna check the back. Okay, I'm gonna palpate the back area. Alright, I'm gonna palpate the back. Alright, any tenderness, swelling, bruising, deformities, bleeds, nothing. Alright, and then cervical spine. I'm gonna check the same thing for that as well as the buttocks. Okay, I would check that as well. Everything's clear. Okay, so now I'm going to take my vitals. Turn around for me. His blood pressure is 95/60. Okay. 95/60. His pulse. We're gonna check his pulse. His pulse is 124, and his respiratory rate is 24 breaths per minute. It's a little shallow. Okay, then we'd place a saturated O2 thing on his finger if I had it. For this instance, it is 95% on room air, and then I already did pearl for his eyes, so that's clear. So then now at this time I would make sure the high flow oxygen is on properly, it's working, and reassess his vitals every 5 minutes en route to the hospital. And then give my patient care report.